Hi guys, this is RN Daily Dose, formerly as Inday RN, and here I am to give you some helpful tips to maximize your study for the exam. And before we're going to start, please don't forget to click like, comment, and subscribe on my channel, especially if you are new.
(31) The nurse is performing abdominal thrusts on a conscious, choking client. Place the nurse's actions in the sequence in which they should be performed. (32) The adult client reports to the nurse that he feels like he is choking. The client is coughing loudly, and his skin is acyanotic. What action should the nurse take next? (33) The nurse sees the co-worker assisting the obviously pregnant client who appears to be choking. The co-worker's fist and hand placement is appropriate. Which description best describes the co-worker's hand placement? (34) During transport for an emergency surgery, the client experiences a cardiac arrest and dies. The client's family witnesses the arrest and is present when the client is pronounced dead. Which action by the nurse best demonstrates compassionate care? (35) The nurse is to administer epinephrine 1 mg to the client during a cardiac arrest. Epinephrine injection 1/10,000 is supplied in a syringe for administration. The 10 ml syringe states 0.1 mg per milliliter. How many milliliters should the nurse administer? ml. Record your answer as a whole number. (36) The nurse is caring for the 4-year-old with respiratory distress. The child has pale, cool skin, is hypotensive, and has an HR of 54 bpm and decreasing despite respiratory support. Which intervention should the nurse implement? A. Begin chest compressions. (37) The resuscitation team has been performing CPR on the child for 15 minutes. The mother, who is present during the resuscitation, asks when CPR would be stopped. What is the most appropriate response by the nurse? (38) The cardiac monitor of the 6-year-old shows ventricular fibrillation. Which interventions should the 2 responding nurses implement? Select all that apply. The nurse is performing CPR on the 5-year-old in asystolic cardiac arrest. A second rescuer arrives. The client remains pulseless and apneic. What intervention should the team provide next? The nurse is performing CPR on a neonate. Which action indicates that the nurse needs further instruction on performing CPR on a neonate?